Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show.
Systemic retinoids, Isotretinoin, coming to their FDA approved uses. Nodulocystic acne, we all know. Resistant acne with a tendency to scar. Isotretinoin acts on all the four stages of pathogenesis of acne. First, it will reduce the sebum production, reduces sebocytes, inhibits the proliferation of sebocytes, makes sebaceous glands to get atrophied. This S for reducing sebum effect. This K for it normalizes the process of keratinization. I for anti-inflammatory effect. It inhibits toll-like receptor 2, which is involved in pathogenesis of acne, and acts as a anti-inflammatory. And this N is for antibiotic effect, that is indirect antibiotic effect. Isotretinoin is not a true antibiotic. What is the from where this bacteria will get nutrients? Through sebum. Here it is reducing the sebum, so indirectly it is making nutrients not available to bacteria, thus acting as a indirect antibacterial. Clear? All the four stages of acne is getting inhibited by isotretinoin. Mnemonic: skin, sebum, keratinocytes, anti-inflammatory, nutrients, lack of nutrients to bacteria. Next, acitretin, used in pustular psoriasis. Drug of choice for pustular psoriasis is acitretin. Erythrodermic psoriasis, severe recalcitrant plaque psoriasis. Then bexarotene, FDA approved use is cutaneous T-cell lymphoma, which is non-responsive to other systemic therapies. We'll go to retinoids when rest of the things failed. Coming to off-label uses, just remember the headings. Whatever the disease comes under this heading, you can write in your exam if you wanted. Cornification and related disorders like ichthyosis, keratoderma, diarrheas, rosacea and related disorders like rosacea fulminans, acne with solid facial edema, pyoderma facial, hidradenitis suppurativa, AIDS associated eosinophilic folliculitis, eosinophilic pustular folliculitis. Inflammatory diseases like pityriasis, rubra pilaris, lichen planus, chronic hand eczema, neoplastic diseases like epidermal pre-malignant diseases, SCC, BCC, Kaposi sarcoma, keratoacanthoma, chemoprophylaxis of neoplastic disorders like xeroderma pigmentosa, basal cell nevus syndrome, miscellaneous disorders like subcorneal pustular dermatosis, sarcoidosis, verruca, graft versus host disease, granuloma annulare. Coming to adverse effects of systemic retinoids, everyone must know these adverse effects, mainly teratogenic effect, which is idiosyncratic. Except this teratogenic side effect, rest of all the side effects are dose related. So that means if we stop the drug, rest of the all side effects will come to normal. But this teratogenicity is idiosyncratic. That means there is no minimal safe dose in pregnancy. Even just a single tablet may cause teratogenicity. Main defects are craniofacial defects like micrognathia, cleft palate, depressed nasal bridge, ocular hypertelorism, that is widely spaced eyes, eye and ear defects. CNS defects like microcephalus, hydrocephalus. CVS defects like Fallet's tetralogy, septal defects, transposition of great arteries. Thymic hypoplasia, aplasia or thymic ectopia, all these are teratogenic effects. So, because of this teratogenicity, proper contraception or complete abstinence must be followed at least 1 month prior to treatment, during treatment and after treatment also for a defined period, like 1 month for iso, 3 months for acitretin. After this time period only, they will get completely eliminated from the body and body will be a safe place to bear children. Patient must strictly avoid alcohol in case she wants to become pregnant, and if she is drinking alcohol, as alcohol increases the T half, mainly acitretin. Even if she waits 3 months after stopping acitretin, some of the drug may be left inside the body, which is dangerous to her baby in future. I pledge. This I is for Isotretinoin. This pledge, it is a program mandated by US FDA for Isotretinoin risk evaluation and mitigation strategy. What are the goals of I pledge REMS? To prevent fetal exposure to Isotretinoin, obviously. Then to inform prescribers. Who are the prescribers? We, doctors, pharmacists who will dispense the medicine, patients who will receive the medicine, about serious risks and safe conditions. All these three groups should know what they are prescribing. Patients should know what they are receiving, how dangerous it is. For that, what are the requirements of I-Pledge system? Patients, prescribers, pharmacists, all are required to register and use a website. What is that website? www.ipledgeprogram.com. To receive, who will receive the drug? Patients. To prescribe, who will prescribe? Doctors. Or dispense the drug, who will dispense the drug? Pharmacists. All three groups should register in this website. All patients must sign the informed consent, and at the time of registration itself, each patient will be issued a unique ID card. For women of childbearing age group who are at risk, prescribers should enter confirmation of patient counseling that they have given adequate counseling. Pregnancy test results, they have done baseline pregnancy tests and checked she is not a pregnant, and advised about contraceptive usage. Patient must also access I-Pledge. Why? They should answer certain specific questions. Then, after fulfilling all these above requirements, pharmacy will be allowed to fill a single 30-day prescription within 7 days. After all this process, just 30 tablets they can get by filling the prescription within 7 days. This entire hectic process they should undergo, then only they will get Isotretinoin. This website will contain all the pharmacies where Isotretinoin tablet will be available also. Next, rest all the side effects which are dose related and reversible are mainly dryness of skin and mucosa, which is most common, and earliest is dryness. More with Isotretinoin. Dry lips or cheilitis is the earliest and most frequent. It also serves as a marker of compliance. That means if a patient got dry lips, it indicates that he or she is taking tablets regularly and maintaining compliance. Dry eyes, blepharoconjunctivitis. Because of the side effect of dry eyes, patient should avoid contact lens. Peeling of skin or palms and soles. Elevated liver enzymes, elevated serum lipids, central hypothyroidism, CNS side effects like headache, pseudotumor cerebri. Clinical features of pseudotumor cerebri are severe nausea, vomiting, headaches. This risk will increase if we prescribe tetracyclines along with Isotretinoin. That's why never ever prescribe tetracyclines with Isotretinoin. Hair fall like telogen effluvium, nail fragility, onychorexis, onychoschigia. Leukopenia, mainly with Bexa. Sexual dysfunction like reduced libido, erectile dysfunction. Depression, mainly with Isotretinoin. Isotretinoin will treat nodulocystic acne. If acne goes, patient's depression also will go away. But with the drug itself, some rare cases are there who had got suicidal ideations and depression. Bone, diffuse, interstitial, skeletal, hyperostosis. Dish. We all must have known about this dish during our NEET PG preparation itself. Along with that, premature epiphyseal closure, osteoporosis, that is reduced bone mineral density. Can a patient having a teratogenic drug inside his blood can donate blood? No. WHO recommends patients on retinoids not to donate blood. Until what time? They have to wait until T max plus 5 times the T half of the drug. so that 97% of the drug will be eliminated by that time. Rest 3 won't do any harm. After that, they can donate blood. What is Tmax? The time period for which the drug's concentration will be at its peaks, plus 5 times the T half of the drug. That much time a patient should wait after taking a retinoid to donate his blood. Investigations and monitoring. While studying adverse effects itself, we should guess what are the investigations required. Baseline urine pregnancy test. Obviously, it is a teratogenic. CBP. It is causing leukopenia, agranulocytosis. RFT. It is getting excreted through kidneys only. LFT. It will elevate liver enzymes. Here, liver transaminases are getting elevated. Serum lipids also. So, we should do lipid profile. As a special test, it is involving bone also. So, we can do X-ray also to check whether bones. Then follow up. Monthly we have to follow up for 3 to 6 months. Then 3 months once we can follow up with all these blood tests except urine pregnancy test, which is necessary every month mandatorily. After 3rd month also we should do urine pregnancy test 4th month. Not like rest of the investigations which we can do 3 months once later. Coming to contraindications, absolute contraindication for any drug is hypersensitivity. We can write this in exam closing our eyes. Here it is teratogenic, so pregnant and lactating. Relative contraindications like leukopenia, abnormal lipid profile, significant liver and renal dysfunction. We'll know a little bit about Kligman's formula and modified Kligman's formula. Why they have modified this formula? Original Kligman formula will contain retinoid 0.1%, hydroquinone 5%, dexamethasone 1%. Dexamethasone is a potent steroid, so this formula will have increased potency. Retinoid 0.1% will lead to increased irritation of the skin. To reduce this irritation, to reduce this potency and make it somewhat safer to use, they have modified this Kligman's formula by reducing the percentage of retinoid to 0.025 to 0.05. 2 to 4% hydroquinone, from 5 to 2 to 4%. From a potent dexamethasone to mild steroids like hydrocortisone, mometasone furoate, fluocinolone acetonide. With this, we can formulate various combinations of modified Kligman, either using 0.05 retinoid, 2% hydroquinone, with combining with either hydrocortisone, mometasone, fluocinolone acetate. Like this, we can formulate various combinations of modified Kligman's formula. We can choose what to prescribe. Every modified Kligman's formula will be somewhat safe, less irritating and less potent, as they have mild steroids only. This classification of topical steroids we will deal with in our immediate next topic. Until then, remember, these 3 drugs will come under mild steroids. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. Das vidania.